Meanwhile, health facilities are not spared from the water outage crisis. And joining us now to unpack the impact on hospitals and clinics is Far East Rand Hospital CEO Sonwabo Lindani. Good to have you, and thank you very much for coming on this evening. The Deputy Minister saying, well, we are sorry communities are being exposed. Maybe, exposed is probably a poor word to choose, because the experience is more than just being exposed to severe conditions. Talk to us about what the experience is.
Good evening, Mr. Mdluli. Thank you so much for the opportunity. I was indeed listening to the Deputy Minister there speaking about the challenges that are brought by water, shortages, particularly in the health facilities. That's where my focus will be. Mr. Mdluli, hospitals, they run largely on water. Everything we do, is the center of it is water. And I think coming from COVID, the importance of ensuring that the infection control measures are followed and adhered to. So the hands has to be washed all the time. And in theater, for all the procedures that we do, we use a lot of water. So indeed, health facilities are severely affected when there are water interruptions. But I must say, as the health department, particularly in this case, Gauteng Health, we have mechanisms in place for such situations, because we have backup tanks. Each facility, on average, we have about 2. And then facilities such as Rahima Musa and Helen Joseph, they have boreholes. And I think the department is exploring even digging more boreholes in other facilities. What is helping us a lot is the backup tanks that have large capacity that can last up to 24 hours. Then we work closely with the municipality that keep on coming to refill the tanks. Yeah. But indeed, it is a big challenge. And
what's the degree of engagement with the authorities, particularly on that score? I mean, in facilities where they would need, I suppose, that level of intervention, where there is no borehole at the moment and they would want a borehole, or there are no backup tanks and they would want those to be in place. How easy and how accessible are those facilities?
No, Mr. Mdluli, I think you are privileged. I think it's Gauteng province. I think most of our facilities, they have the reserve tanks. So normally municipalities, they will know when there are going to be water interruptions. Then contingency plans and measures, they are put in place where the tankers, they come and refill our backup tankers for up to, that lasts us up to 24 hours. Like for instance, in the case of Helen Joseph, they have 3 water tanks, each that can carry up to 260,000 liters, and they also have boreholes. So some, they even have bigger capacity. Far East Rand, we have 2 water tanks. Each is able to give us about 500, the other one is about 200,000 liters. So that coordination with the municipality is very important, and we need to keep on monitoring the water levels. We do have the DID team. In the case of the department, we have the DDG that has been appointed, Mr. Galata, who's assisting largely during this situation. So what is key, Mr. Mdluli, is the coordination and also working very closely with the municipality.
So, and we are on day 10 now. I mean, how long are those facilities able to carry you?
The refilling of the tanks, Mr. Mdluli, they happen on a daily basis. We keep on monitoring them, but those refills, they don't wait for the tanks to be empty. And the capacity of our tanks are able to make us to function normally, because they are quite big and they can last up to 24 hours. So we monitor them regularly during the day. Then in the following day, they come to refill. So the key element is that relationship with the municipality that are very handy and very helpful in coming with those tankers, and then they fill our reserve backup tanks.
We appreciate your time. Thanks so much for coming on, CEO. That's Far Eastern Hospital CEO Sonwabo Lindani there.